So esophageal cancer has been increasing, and the type of esophageal cancer has been changing. Traditionally, 25, 30 years ago, when we talked about esophageal cancers, they were all a type known as squamous cell, or majority, I should say. And the difference was that the majority of those were caused by abuse of alcohol and smoking. Now, in the past 25 to 30 years, we've noted a tremendous change. The majority of the esophageal cancers we're diagnosing and treating now are known as adenocarcinomas. Adeno standing from that they start from the glandular component rather than the lining. And the difference is we figured it's related to more increased incidence of reflux, more Barrett's esophagus. So symptom-wise, I think if people have chronic reflux, they must address it, must have endoscopies done to make sure that they are not developing Barrett's. Barrett's is a precancerous, changes in the lining which down the road can. I want to say that not all Barrett's is going to change into cancer. In fact, majority won't. But there are degrees to Barrett's. If it's very early mild, we may just treat it symptomatically. If it's more advanced, we may treat it more aggressively. But important thing is in recognizing that if you do have chronic reflux symptoms, make sure you're taking the right precautions, taking the medications, getting endoscopy, losing weight if appropriate, getting the right treatments for it. Also very important is that people realize that alcohol has been found to be a risk factor for a variety of cancers. And I'm not talking about social alcohol use. I'm not talking about drinking a glass of wine over dinner. I'm talking about heavy alcohol use has been linked to a variety of cancers, including esophageal. So moderation, eating more greens in your diet, that's been found to be very helpful. Also, less red meat has been found to be helpful. Those are all good general suggestions. Maintaining an ideal body weight, exercising. Also in esophageal cancers, the treatments have gotten better. We have gotten better with chemotherapy, radiation techniques. We've gotten better with local therapies, pinpoint ability of radiation, we've gotten better. We've also found some molecular mutations in esophageal cancers like the HER2, which was originally diagnosed in breast cancer. Now we find it in maybe 10%, 15% of esophageal, but in those patients, the outcomes are a lot better if we treat them with Herceptin-based therapy, which is the drug originally approved for breast cancer use. So I think those are tremendously positive developments. Also, sending esophageal cancer tumor specimens for molecular testing like Foundation 1. We've been able to find other mutations which were not commonly associated. But we find that the treatments are the same. If you find a mutation which could be relevant for, let's say, melanoma, but you find it in esophageal cancer, you can use those treatments and they'll work likely just as well. So tremendously hopeful, still a long ways to go.